Thank you, Mr. Chairman.
Appreciate your willingness to testify on this issue. Feel free to move forward and testify. Thank you.
Thank you and members of the committee. My name is Scott Burns. I'm the Deputy Director at the White House Office of National Drug Control Policy for State and Local Affairs. And I appreciate the opportunity to provide information to the committee regarding issues critical and of importance regarding this bill. As the members of the committee are aware, the administration has consistently followed the judgment of the Food and Drug Administration, the FDA, that smoked marijuana is not an approved medicine. In April of this year, the FDA publicly reiterated its conclusion that smoked marijuana does not meet existing standards of safety and efficacy for modern medicine. In addition to the concerns over the lack of demonstrated medical efficacy of smoked marijuana and the well-demonstrated health risks, there is the further challenge presented by proposed state actions to the integrity of the drug approval process. By law, and for good reason, the FDA is the sole government entity charged in the United States, these 50 United States, with testing and approving new medications. Adherence to this system has played an important role in protecting Americans seeking treatment for illness. Prior to the creation of the FDA in 1907, Americans were barraged with a variety of claims about the supposed safety or effectiveness of a range of folk remedies and addictive substances. The majority of these so-called cures contained alcohol. Those who consumed it would, not surprisingly, report that they felt better after consumption. But these substances were not necessarily safe or effective. And in many cases, snake oil salesmen were simply hawking their products without the safeguards and protections that today, as Americans, we rightly expect from our government, thus the FDA. And that is why, over the last 100 years, a compact based on trust has been formed between the patient, the physician, and the government. The compact is this. A patient can expect that a physician will only prescribe a medication proven to be safe and effective, and both patients and physicians can expect that the government recognized medications have been determined to be only safe after properly rigorous scientific analysis, not political pressure and not deal-making. Americans have come to know that the FDA is required to engage in serious, rigorous, long-term clinical studies about the safety and effectiveness of medications. I think Mr. Murphy, the former Maryland official, cited the IOM study, and I encourage you to get that study and read it in its entirety. Ultimately, the IOM report concluded that the usefulness of marijuana for medical purposes is limited by the harmful effects of smoking, and that because smoked marijuana is a crude delivery system, and I want to emphasize that, smoking this weed has been determined to be a crude delivery system, that the verdict of the report was that marijuana is not a modern medicine. The Institute was particularly troubled by the notion that the crude marijuana might be smoked by patients, which it termed a harmful drug delivery system. Let me conclude by saying two things. The decision before Michigan lawmakers is an important one. It touches on two key issues: the question of how we treat illicit drugs in our society and how we determine what is and what is not a safe and effective medicine. With respect to the first issue, marijuana continues to be the most widely used illegal substance in America, especially among our teens. There are more young people between the ages of 12 and 17 years old in treatment for addiction to marijuana than for all other drugs combined. For addiction to prescription drugs, for addiction to cocaine, for addiction to methamphetamine. Visit a treatment center, talk to a counselor about young people and the addiction to marijuana. The second issue is the integrity of our medical system. I would urge lawmakers to consider the medical system that we have fought to establish in this nation, and that it serves as a model for the rest of the world. Americans rightly expect a medication which has the FDA seal of approval to be safe and effective. Decisions made on the basis of politics rather than science and medicine violate the trust that forms the basis of the compact between the patient, the physician, and the government. It further turns 100 years of progress on its head. When faced with the question of whether to declare smoked marijuana a medicine by legislative vote, state lawmakers should reject that approach and instead renew their commitment to ensuring that decisions about medicine are based on data resulting from medical research and scientific inquiry. I thank you for considering this information, and I'll answer any questions that you may or may not have.
Thank you, Mr. Burns. A number of members of questions. Let me first ask, the FDA is then the proper process by which we determine whether or not drugs are safe and effective.
Yes.
Was Vioxx approved by the FDA?
Was what?
Vioxx approved by the FDA?
Yeah.
Thank you for being from the federal government and here to help.
Yeah.
Well, Mr. Chairman, I would just ask you to treat me with respect, and I'll treat you with respect. Is that fair?
That would be fair.
Thank you.
We have questions, Representative Lemons. You first.
Thank you, Mr. Chair. You mentioned that we don't make policy political. Wasn't the prohibition a political decision? Both the repeal of both prohibition and its repeal, weren't they in fact political decisions rather than medical decisions? And do you support the prohibition of alcohol, because we know that is probably more abused and more young people and more people abuse alcohol? That's the first question. And you can say the second part is has to do with the alcohol content in medications, even over-the-counter medications, NyQuil, et cetera, et cetera. Doesn't the FDA approve that? And are those substances abused as well? We have children abusing cough medicines, et cetera, over-the-counter medications. And secondly, and finally, the vapor. You talked about smoke marijuana. What about the vaporization and other delivery systems that could, that technology today allows for purification and a better delivery system? If there was a better delivery system, do you think the FDA would remove its objections to it? If that's the primary objection to the ineffective delivery system, do you think the FDA would remove such delivery systems?
Well, I'll answer your last question first, and I'm not a physician or a scientist. And the gist of my statement was that in America, we rely on experts to provide us with those decisions. The FDA is made up of scientists and doctors that do studies. They have determined that the crude delivery system of THC by smoking this weed is not a safe and effective medicine. It's not. That there are other alternatives that have been determined safe and effective. And while testimonials by people that it makes me feel better may be relevant in part, they make that decision, the scientists and the physicians in the FDA. With respect to prohibition and the whole alcohol issue, look, we know in all 50 states the trail of tears and death of young people that have become addicted to alcohol, and the families and the ravages. And I don't think there's probably anyone in this room that hasn't been touched by someone they know that abuses alcohol. But there are 126 million people that regularly use alcohol in this country. There are currently only 19.1 million people illegally using controlled substances, drugs that the federal government has said are illegal, or using them in an illegal fashion. So why would we try and repeat the trail of tears by comparing one social ill to another and say, well, you know, alcohol's terrible, why don't we legalize smoking crack cocaine?
No.
Makes me feel better.
Well, actually, cocaine is legal under a doctor's prescription. That's correct. Cocaine
Under certain
right. So a doctor
yes.
can prescribe
Yes.
if he thinks
The
cocaine
FDA has determined that under
and
certain
morphine, et cetera. So those things already exist.
Right.
But a doctor cannot. But there are a lot more. You would agree that that cocaine is far more addictive than marijuana, biologically addictive, because you use the term addictive. Maybe it might be psychologically addictive, but I don't know if marijuana is actually biologically addictive. What is the? I lost my train of thought. So go ahead.
There's a number of people with questions. Let me just ask, follow up on a question by another testifier, that in states where similar laws have been enacted, what has been the experience with marijuana use in those states? Has it shot up dramatically? Has it gone down? Do you have any knowledge of what happened in those states? We've heard testimony that it hasn't increased anymore, it's actually decreased compared to other states where it's remained completely illegal.
Yeah, that's what's so interesting about, to me, states that are now entertaining the legalization for medical marijuana. We have seen a 20% decrease in the United States over the last 5 years of drug use among young people, and it's primarily in marijuana. Use is going down all over the country. We believe it's for a number of reasons. We believe because parents, for the first time, are having discussions with their children about the fact that this is not the drug of the 60s. It is a different drug. It was 1 and 2% THC levels back in the 60s and 70s. It now averages between 8 and 12%. In Michigan, which borders with Canada, and a major bridge and thoroughfare, BC bud, or British Columbian bud, is as high as 30% THC. It is
What about
a
states where it's been, with this similar laws that's been enacted, I'm asking what the difference is in usage in states compared to those that haven't enacted.
and my answer is in all states in the country, to some degree, marijuana use is going down. So that would be the 38 states that have
Similar
no...
laws have not resulted in an increase in marijuana use. Similar laws in the states.
Well, if you ask me, I believe they have. If you go to Oregon or if you go to California, absolutely. If you talk, it's all anecdotal. I don't know that there's been a study with respect to direct correlation of when a medical marijuana act is initiated and the effect that it has on drug use or not. Because I'm telling you, Mr. Chairman, marijuana use is going down nationwide, so I don't know how you correlate or explain that.
Okay, so you're not aware of any studies that indicate any increase in usage anywhere as a result of a similar law passed,
It's going down. Marijuana use in this country is going down,
regardless of what the law is regarding medicinal marijuana.
based upon education efforts, prevention efforts, law enforcement efforts. Marijuana use is going down.
Great. Okay, we have Representative Emmons, Representative Lemons, Representative Garfield. Let's start. Okay. Representative Lemons, you have follow-ups to the question? Okay. Representative Garfield and Representative Hogendyke.
Yes, you stole my line about I'm here from the government, I'm here to help. Let me tell you that this body, I know many of us Republicans have been trying to defend, I don't want to say the word defend, but trying to keep the drug companies from having double jeopardy. If there's a class action suit considering such as Vioxx versus each state suing, because many of us are afraid that they will raise the prices of other drugs to make the payoff if you go to the separate states. So we have a problem with them possibly raising other drug prices to pay for a double jeopardy situation. It's a class action suit and they lose, and then all 50 states, you know what they're going to do is raise the rest of the drugs that they've made to the rest of us to pay it off. It's like tobacco stuff. So many of us have felt that by doing this double jeopardy situation, that it would be best for us to allow a class action suit, and now we're hearing that that might not work out anyway. And many of our Democratic colleagues said, they want to sue whatever, and we've been trying to protect it, I think, from a standpoint of raising the drug. I'm not, there are times the FDA makes mistakes, like any other body. We make mistakes. And when we're not human enough to say we made a mistake, and people have been injured, I have a problem with that because we do make mistakes.
We're at 20 minutes and we've got 20 people to testify.
As Representative Lemons alluded to, we took over-the-counter drugs off the market because they were using that to make methamphetamines in our state. So there are things that happen that we don't know they're going on until they're brought to our attention where we have to take corrective action. I just want to say, once again, that we're not beating up on the FDA, that's your personal view. But once again, I don't know what people will do under pain and suffering. I just don't know what they would do. What would you do? And I want to leave you with that. Thank you.
Okay, Representative Hogendyke.
Thank you, Mr. Chairman. There are drugs that have medicinal purposes or improve health, like drugs to reduce blood pressure or reduce cholesterol levels, and then there are drugs that I don't think have any healing or medicinal use other than to relieve pain. Correct? We have FDA-approved drugs that are strictly for the purposes of relieving pain.
I'd have to agree with you in general. Like I said, I'm not a physician, or
Right.
I'm not a scientist, and
Okay,
so
that's fine.
I don't want to testify with respect to issues that I have no
And I think
expertise.
the idea of medical use of marijuana is not to improve anybody's health per se, to alleviate cancer or Crohn's disease or whatever, but to relieve pain. My question to you is, has the FDA done testing on marijuana as a potential prescribed pain reliever? Do you know whether or not the FDA has ever done that?
Yes, I think if you look at the ILM study and other studies, you'll determine that the efficacy of marijuana as a medicine, all aspects of potential benefits and harms was looked at. And as was pointed out, in parts of the study, they said it had some beneficial aspects to it, but that the crude delivery system, smoking it, the carcinogens, lighting it up, smoking the weed, outweigh any benefits that it potentially deliver. Now that's what the scientists and the physicians say. We can snicker and we can laugh and we can scream, and we can engage in the politics of determining what is or what isn't medicine. Let's vote on OxyContin, all in favor. How many think Vioxx should be a medicine? The whole point I'm making is in this country, when it comes to medicines, we have determined that we will rely on experts, people that we send to great institutions here in Michigan as well as across the country who have that expertise, and then we look him or her in the eye and say, is this an acceptable medicine? To date, in our country, they have said no.
Okay, and then just one further question. I have this statement from the Food and Drug Administration stating that marijuana is listed as a Schedule I controlled substance status, which I guess is the most stringent level, for 3 reasons. It has a high potential for abuse, it has no current accepted medical use and treatment in the United States, and has a lack of accepted safety for use under medical supervision. Are you able to comment as to why you think marijuana is still listed as a Class 1 or as a Schedule I? And if it wasn't, I'm thinking it might be the leisure to implement this legislative.
I think for the reasons set forth in the FDA's test, it does not meet the test. Period. Thank you.
Thank you. Representative Sheen, we have 11 and 20 minutes. Just a simple question. Hearing those people, the lives that have been lost, the lives that have been saved by the FDA research, what would you say that percentage might be? If you compare the number of lives saved to the number of mistakes or lives lost based on mistaken FDA. It'd be hard to quantify the number of people who died because the drug was not approved by the FDA. I don't know, has there been a study? I'm just asking in comparison to the mistakes they've made and the lives they've saved. I'm sure they know that percentage. No, they would know. I would imagine it would be easy to study the number of people who suffer as a result of a drug approved by the FDA who properly approved. It's probably impossible to quantify who is suffering as a result of the drug not approved.
Would you prefer I can ask the question?
Yes. Go ahead.
Well, I think it's obvious. I think that we have the best medical system in the world, and that the drugs that have been approved over 100 years in this country have saved millions upon millions of lives, as opposed to those that have had problems and have been revisited.
Representative Lemons.
Thank you. Quite quickly, because I didn't pose it in a form of a question. You didn't really answer the question of vaporization with a high-tech delivery system, and I guess the scientists didn't. So if your only objection is the delivery system in terms of smoking and carcinogen, and also could we not regulate the quantity? If it was medicinal, we could eventually regulate how much of the THC versus the 1960s versus the 2000s, et cetera, et cetera. And you do have experts that disagree on the medicinal use of marijuana. That's why some physicians would prescribe it. And finally, the cocaine. Again, we return to cocaine. Do you think that cocaine is more harmful? Or has the FDA, are you saying the FDA has found that cocaine is better in certain situations than marijuana. Are you saying that for medicinal purposes?
Well,
Delivery system and cocaine.
what's that?
Expert delivery and then comparison to cocaine.
Okay, delivery, vaporization, I didn't read that in the bill. I don't know what you're talking about. I know that there are some other delivery systems for some other medication, but I have not seen it in this bill or any other bill regarding whatever vaporization is. With respect to the THC content, the only point was made that of the 19.1 million drug users in this country, 75% are singularly or co-using marijuana. I bring that up because we are engaged in an effort to push drug use down. We want young people not to use drugs. We support what happened in Nevada, where they voted no on legalizing marijuana, and in Colorado, and in South Dakota, where they just turned down medical marijuana by initiative. So I bring that up to encourage that we educate ourselves about the illicit use of this drug in our country as well, and potential harmful effects in Michigan. The third one, with respect to cocaine, I think I answered it once. The FDA has determined that under certain circumstances there is a medical efficacy for cocaine. When a doctor can prescribe it for a certain malady, they have not done that for marijuana. I don't know how to explain it any simpler.